So hello, my name is Ronald Piaseczny, and I am the president of Niagara Pride. We are a 501c3 nonprofit here in Niagara County, servicing the LGBTQ plus community. Just want to give you a little bit of background on me today. I always hate giving this part of a presentation because it feels like you're filling out like a dating profile about yourself, so it's really weird. But I graduated with my degree in psychology from the University of Buffalo. I originally went to school for political science. I went to law school. While in law school, I volunteered and interned at the Philadelphia Civil Rights Center for gay and lesbian individuals. I founded our school's chapter of Outlaw. And then when I came back to Buffalo, I completed my psychology degree, then got my master's in counseling, and was also working towards a PhD in counseling. I've worked in a number of nonprofit agencies delivering mental health services, LGBT services as well, addiction services, and as of most recently, as I indicated, we founded Niagara Pride. We've been around for about 3 years. We were part of the Pride Center of Western New York. And last year, we splintered off and created our own nonprofit organization, Niagara Pride. So today's presentation is entitled, it's a long presentation, and if you guys saw the PowerPoint slides beforehand that Peter had sent out, there's a lot of slides, but trust me, I will not be going through all of them. Because there's a lot of information. I just kind of want to touch on some of the highlights of the talk today. But today's presentation, the numbers behind Pride, why LGBTQ plus Pride is still needed. There have been, over the last couple of years, a lot of advances in LGBT visibility, as well as you've seen court cases and you've seen more visibility. And so it appears that everything seems to be going in a positive direction. And so I just kind of want to step back and take a look and see, why do we still celebrate Pride every year in June? Is Pride Month. And kind of take a look and see, maybe there is still a need for promoting LGBT diversity and awareness. So if you'd like to go next. So I just want to kind of go over some relevant terminology for today. A couple of key things. I'm sure people have probably heard the terms lesbian, gay, bisexual, but what are maybe some terms that people are not familiar with? Transgender. So transgender is a term that, that often is kind of seen as an umbrella term, which encompasses individuals who identify as a different gender than that which is assigned at birth. And that's, again, an umbrella term. And you may have heard the term cisgender. That seems to be a newer word that's coming about that we tend to use in the mental health setting, but as well as when we talk about LGBT issues. Cisgender refers to individuals whose gender matches the gender that they were assigned at birth. So just a little bit of background on that. We hear the word queer. This used to be a slur for the LGBT community, but it's being reclaimed by a number of members of the community. And a lot of people accept that term as a definition of how they identify in terms of their sexual orientation or their gender. It can take on many connotations. So when you hear somebody identifying as queer, you may want to ask some follow-up questions to really find out what that means to them. Because again, it's almost like an umbrella term, but again, you won't go wrong if you genuinely ask somebody if you don't have an understanding of what the terms mean. I always tell people, go ahead and ask questions, be respectful, find out about that person, how they identify. You can't go wrong with that. You'll see the abbreviation BIPOC, and that stands for Black, Indigenous people or persons of color. You'll see that a lot of times that may be like a more social worky kind of term or a legislative kind of term, but it just refers to individuals of color. So just so that you are aware. Next. Gender affirming healthcare, I'll be talking about that. That's one of the things that we strive for at Niagara Pride is having resources to providers who are gender affirming. It's also a term that can apply towards sexual orientation. We look for providers and want medical health providers that are aware of LGBTQ needs and healthcare needs and that are supportive. It can include hormone therapy, gender reassignment surgeries, but it can be a more broad term, just somebody who is familiar and accepting of LGBTQ individuals. And I want to touch on the idea of sexual orientation, which is the attraction that one feels for an individual. And then if you, let's see, if you skip actually to the next slide, you'll see that there's a little bullet point, sex versus gender. And sex versus gender, when you talk about gender identity, you'll start hearing individuals talk about transgender identity or intersex. And I just want to make that distinction in people's minds that your gender is not the same as your sexual orientation. And for some people, that's kind of a new concept or they've never thought of it that way. But somebody may identify as a different gender, but who they are attracted to is completely separate from that. So when you hear individuals talking about being transgender, an individual who may say that they were born male but feel that they should be female, you can't make that assumption, well, then that individual automatically is going to be attracted to men. That's what that is. They may be attracted to women. They may be attracted to other sexual orientations. So again, having those conversations with individuals when you're getting to know them is usually the best way to really kind of find out where that person is. And you can't make assumptions about gender and sexual orientation. And along with kind of some of the newer trends that we're seeing with mental health and social work and in terms of LGBT awareness and acceptance, we're seeing a lot more individuals identifying their pronouns, basically kind of putting that out there first and saying, like for myself, I identify as he, him. You may come across somebody who says they, their, that they want to use more that non-specific gender. They may have other terms that they want to use as to how they want to be identified. So if you see those kinds of things in emails, in writings, you'll see that a lot, that people will now put under their name in like an email, he, him, she, her, they, their, or some other type of gender pronoun that they would like to be identified as. So next. So next part of the presentation talks about some milestones in the LGBT movement. And there's a lot of slides. I'm gonna just kind of highlight a couple of things that are on the different slides. But again, I think it kind of helps us to have a little bit of context when we talk about the LGBT rights movement and again, why we still need pride and why is it relevant today. It helps having that little bit sense of historical context for it. So next. So you'll see that the very first date that's on the slide there from 1924, the Society for Human Rights was founded. And this is the first time that we have any documented LGBT rights organization. And again, back then, we didn't have all the terms transgender and whatnot, but it was identified as a gay rights organization. Fast forward a little bit from 1924 to April of 1952, and we start kind of seeing, even though we know historically that LGBT folks have not always been accepted, but we see here in America that April of 1952, the American Psychiatric Association, in their Diagnostic Statistical Manual, actually lists for the first time homosexuality as a sociopathic personality disturbance. And so it's the first time that we actually now have it in the medical literature, clinical literature, basically indicating that being LGBT is a pathology and is something medically wrong with individuals. Going forward from that time period, we see there's April 27th, Dwight Eisenhower signing executive order banning homosexuals. from being able to work in the federal government, citing that homosexuals would be a security risk to the government. Next. July 1961, we see, and again, going back to the first date of 1924, it took that many years until 1961, where Illinois becomes the first state to decriminalize homosexuality by repealing its sodomy laws. So, long period of time where that was the case, and as you'll see, it wasn't over yet. There was still a long battle ahead of the LGBT community. June 28th, 1969, I actually, even though I was not born in 1969, I love the fact that I share the birthday of June 28th. Is the Stonewall riots. That is considered basically the founding and the birthplace of the LGBT rights movement here in the United States. There was a police raid in a bar. A lot of individuals were arrested. And according to the historical information and what we have at the time, it was Black trans individuals that basically fought back the police and stood up for the LGBT community and our rights. So just kind of wanted to kind of set that stage, that it wasn't until then that we started seeing kind of the rights movement really kind of picking up. And just want to indicate that in 1961, again, that date of when Illinois becomes the first state to decriminalize homosexual sodomy laws, I want to fast forward because it's not in the PowerPoint slides, but I want to give a context that the Supreme Court heard a case in 1986. So fast forward 25 years from that, and that case was Bowers v. Hardwick. And the reason I wanted to write it down is because there were some, in my opinion, appalling quotes in that case. But Bowers v. Hardwick, at that moment, that was the Supreme Court case which upheld the Georgia law making sodomy and making consensual sex between adults, both heterosexual and homosexual, illegal. So certain sexual acts were considered illegal at that time, and the Supreme Court upheld it. The majority opinion was written by Justice White, who wrote that, quote, "The Constitution did not confer a fundamental right to engage in homosexual sodomy." And Chief Justice Berger, who rendered a concurring majority opinion, wrote, "Homosexual sex is an infamous crime against nature, worse than rape, and not a crime that should be named by name." So that again gives you a little bit more of context of what was happening. And that's from 1961 going to 1986. And you'll see there's some things in between there as well. So next slide, please. So fast forward from 1969 to 1970, June 28th, again, we have the very first march with the Christopher Street Liberation, which commemorated the one-year anniversary of the Stonewall riots. In 1973, we have Maryland becoming the first state to statutorily ban same-sex marriage. And basically following that, we saw a lot more states enacting these same-sex marriage bans. And in 1973, the American Psychiatric Association finally reverses its position and removes homosexuality from its list of mental disorders. But again, we're still not done with the equal rights fight. Next. In January 14th, 1975, the first federal gay rights bill is introduced to address discrimination based on sexual orientation. The bill goes to the Judiciary Committee in the Congress, but it is never brought up for consideration. But it's a first step that we actually see legislation moving in a positive direction. Next. On the next slide, we see 1982. So 4 years before the Bowers Act, or the Bowers case that I talked about, Wisconsin becomes the first state to outlaw discrimination based on sexual orientation. And it always strikes me as kind of funny because you would think that maybe New York, maybe other states that tend to be considered more progressive, but yet Wisconsin was the first one to outlaw it. So always a good sign that maybe things were, again, moving in that positive direction. Well, next, we see that even though there were some movement towards hate crime legislation, 1996, we see President Clinton signing the Defense of Marriage Act. And in that, there's language that basically says that the recognition of same-sex marriage will be and it defines same-sex marriage, defines marriage as the legal union between one man and one woman as husband and wife. So finally, there is legislation. It is passed. However, it is passed basically saying on the federal level that marriage is only between men and women. The Defense of Marriage Act came 10 years after the Bowers Act to, again, put it into a little bit of context. However, that same year in December, Hawaii actually decides to give same-sex marriage to same-sex couples. So even though on the federal level, we see the law passed that is depriving individuals of the right to marry, Hawaii pushes forward and grants same-sex marriage to its citizens. Next, please. In 2003 of June, we see the US Supreme Court strike down the homosexual conduct law, which decriminalized same-sex conduct in the Lawrence v. Texas opinion. And this, in essence, finally reverses the Bowers case. 17 years, basically, after Bowers, we finally see that the Supreme Court has indicated that you cannot enact laws which prohibit consensual sexual activity between adults. And May, the next year, May of 2004, we see the first legal same-sex marriage in the United States taking place in Massachusetts. Let's see here. And after this time period, if you go next, you will start seeing on these slides, you'll see a number of dates, you'll see a lot of kind of milestones. And how I indicated before that there were these gaps of prolonged periods of time between kind of LGBT rights movements or kind of events. These almost seem to be coming in quick succession to one another now. So September of 2005, we see California passing legislation or trying to pass legislation that would allow same-sex marriage there, but Governor Arnold Schwarzenegger vetoes the bill. 2006, the New Jersey Supreme Court states that lawmakers must provide rights and benefits to married gay and lesbian couples. 2008, the California Supreme Court, regarding marriage cases, and one of its rulings indicates that limiting marriage to opposite sex couples is unconstitutional. So we're seeing progress on the state level. We're just not seeing it on the federal level at that point. Federally, we see things like don't ask, don't tell, those kinds of policies being enacted. But finally, in September of 2011, don't ask, don't tell is repealed. And we see on May 9th of 2012, then President Obama becomes the first sitting president to actually publicly support gay marriage. Next. In 2013, in a Supreme Court case, United States versus Windsor, the US Supreme Court strikes down Section 3 of the Defense of Marriage Act, and now finally indicating that marriage between same-sex couples is legal and that they are entitled to federal benefits. So that's the first time that the Supreme Court has really taken up that issue and pro-LGBT in terms of marriage. And again, this October 6th of 2014, the US Supreme Court denies review of 5 different marriage cases, allowing the lower court rulings to stand, which allowed for same-sex marriages to occur in Utah, Oklahoma, Virginia, Indiana, and Wisconsin, which opens the door to other states allowing same-sex marriage to occur. Next. And next again, the slide that says April 4th, 2017. Okay. So there we see the Seventh Circuit Court rules that the Civil Rights Act prohibits workplace discrimination against LGBT employees. That occurred on April 4th, 2017. And if individuals are familiar with the Civil Rights Act of 1964, that is a landmark piece of legislation which indicates that you cannot discriminate against individuals based on national origin, religion, sex, race. It's one of the fundamental cornerstones of equal opportunity law in this country. And again, it wasn't until 2017 that the court ruled that Title VII of that act actually does apply and grant LGBT individuals rights, that you can't discriminate against them. June of 2017, the Department of Defense, at this point, new administration comes in, a new president, and the Department of Defense announces that there will be a 6-month delay in allowing transgender individuals to enter the military. And basically a month later, President Trump at that time tweets out that the US government will not accept or allow transgender individuals to serve in any capacity in the military. So we have some advancements, and then we start having some setbacks. Also of note, around that time, the Department of Health and Human Services, under the last presidential administration, was also allowed to discriminate against individuals in the realm of healthcare. Healthcare providers could actually raise religious objections, citing that they don't believe that, or they do not support homosexual, the lifestyle, whatever the phrasing was that they wanted to use, but basically that if their religion was opposed to LGBT individuals, they would not have to provide medical services to the LGBT community, and Health and Human Services defended that right, so much to the point that they actually set up a hotline where individuals could call in if they were the medical provider who refused service and were discriminated or felt harassed by their employers, that they could seek assistance in being able to defend their position on it. Fast forward a little bit more. The next slide, please. March 23rd, 2018, the Trump administration announces a new policy banning transgender people from serving in the military. And that goes to the Supreme Court, which upholds it effective 2019, January 2019. And then next slide, please. And then starting on June 15th of 2020, the Supreme Court rules that LGBT workers are protected from discrimination. The federal law does apply, which is a landmark ruling for the first time indicating that Title VII does extend protections to individuals based on their sexual orientation and gender identity. January 25th of this year, we have President Joe Biden signing an executive order repealing President Trump's ban on transgender service in the military. And I would just like to add a little bit of a note that, let's see here, as of today, and if you kind of picked up on a pattern, you may have seen that a lot of LGBT rights have come about because of court cases. We've had the Defense of Marriage Act, which was federal legislation, but when you look at actual laws that protect LGBT people, they may have come from the state level, but there's been very little actual on the federal level. And so this year, the Equality Act was proposed. It passed the House of Representatives. The Equality Act would, in essence, amend the title, would amend the Civil Rights Act of 1964 and extend protections to gender orientation, sexual orientation and gender identity. It would amend it to include that. It did pass the House of Representatives by a vote of 224 to 206, and it is waiting in the Senate and probably may not go anywhere, to be honest with you, in the Senate. So doubtful that we will see actual federal legislation. But it is good to note, and I always bring this up when I talk to individuals or give a presentation, that when we talk about federal laws and protections, and again, with the need for pride, there are no federal laws protecting LGBT individuals. So a lot of what we have nowadays is because of court cases. But again, when we think that we have all of these different advancements in rights and more visibility, just be mindful that, again, there is nothing on the federal level that protects LGBT individuals. So next slide. So the question being, with all these positive changes and the Equality Act, I'll leave that aside for a moment, but why still have pride then? Because as you saw, there have been some great advancements, and more so in the last 20 years or so, just boom, boom, boom. We had a lot of positive changes, more acceptance, more media visibility. I'm out open giving a speech today here in front of you, clearly a sign that things are getting better, right? Next. Yes and no. There continue to be disparities with LGBT individuals compared to our cisgendered heterosexual counterparts. And that's kind of the crux of what I want to talk about today. So now that you have some terminology and you have some historical background, I kind of want to talk about what are some of those disparities and how those impact the LGBT community, so that we kind of get a sense of maybe pride is still needed. The idea of celebrating pride, we still have to go out there and advocate and do these things. Next. So I'm going to talk about it in a couple of different areas. First kind of topic area, the general financial statistics and obstacles, kind of looking at where a lot of people have basically it's important for a lot of people is show me the money, what's in our pocketbooks. And that tends to be a big thing. So let's take a look at that. 29% of LGBTQIA+ Americans have reported discrimination moderately or significantly impacting their financial well-being. 37% of Black individuals and 54% of transgender individuals have reported some type of impact to their financial welfare. People of color that are in the LGBTQ community have statistically significant higher poverty rates than their same race, cisgendered straight counterparts. And when we look at some of the numbers behind that, we can see that on average, a cisgendered lesbian makes 12% less than the average cisgendered heterosexual woman. And we already know that on average, women compared to men already make less money. In case you missed it, you may be aware, March 24th was Equal Pay Day. How many people have heard of Equal Pay Day, know what it is? Some hands raised, perfect. Equal Pay Day is the day that if you took the year before and a woman in the same field, same job as a male, if you took the entire year's earnings that male earned in that job, a woman would have to work into May 24th of the following year to earn the same as that male did. So now you add on top of that, if you're a lesbian, you're earning even 12% less than your heterosexual female counterpart. Cisgender gay men and bisexual men tend to earn on average 10 to 32% less than similarly qualified cisgender heterosexual men. Next. Sure. I don't have data to support individuals with disabilities, but anecdotally, I can tell you that there are a lot of instances where individuals with disabilities do tend to sometimes earn less, or depending on the severity of the disability. So, but that it is one more additional component that individuals with disabilities, or we could look at other minority groups, but thank you for the question, but I will just kind of keep going forward. Let me see here. Are we on the slide that has 22% on the top? Thank you. So 22% of the LGBT community earns less than $12,000 a year annually. So that is just over 1/5 of the entire LGBTQ population living on less than $12,000 a year. Let that sink in for a second. 71% of LGBTQ millennials with a bachelor's degree have student loan debt that is almost 1/5 more than $100,000 of student loan debt. And why that is significant, because I can tell you that schools are expensive. We see the rising costs of college and all of that stuff. And where the disparity, when you start looking at it, is we already know that there are people struggling in this economy who are especially hit by COVID this past year. We see people talking about not being able to find employment, not being able to have jobs. Paying back $100,000 or more of student loan debt is astronomical in and of itself. But when you start identifying as somebody in the LGBT community and earning less than your cisgender counterpart, it becomes almost Sisyphean. Sorry if I can't pronounce that. It's almost an insurmountable task at that point when you start looking at what that means in order to pay back debt. When you look at, again, dealing and managing with student loan debt, many LGBTQ individuals indicate that they don't have familiar family support that they can rely on. It's way too early in the morning and I have not had enough caffeine. Pronunciations. So 39% of young LGBTQ individuals say that they feel completely accepted by their families, but 33% report being kicked out of their homes once they've indicated that they have come out. So when you think about that, again, that huge number, that amount of debt, trying to find employment, and now you're also potentially struggling that if you are a young individual, 33% of LGBTQ individuals being thrown out of their home and trying to figure out where to go and how to deal with all of that stuff once they do come out. Many say that they've experienced employment discrimination, hiring discrimination, and that again only exacerbates the issue. Next. We always talk about when we hear financial broadcasts and money management, they always talk about trying to have as much money saved up in a bank account in order to live for a couple of months if you're able to do that in case there's a crisis. 60% of LGBT individuals have less than 3 months worth of emergency money. So, and that seems to be kind of that standard that we always say that you should have at least 3 months. I think it should be a little bit more than that because you never know what's going to happen in life. But again, it's given our economy, you look at the struggles, the obstacles, and now compounded by simply coming out of the closet and simply expressing who you love and what your gender is, you're now even adding to that financial difficulty. And the last point on this slide that says that there's something important to be aware of. It doesn't cost more to be LGBTQ. There are stereotypes that LGBTQ individuals have more disposable income, or maybe that they tend to spend more on different extravagant things. Those are stereotypes. There's people that are both in the cisgender heterosexual community that do the same thing as LGBT people. We are no different than our cisgender counterparts. It's what the problem is that when you look at the financial impact that these discriminatory policies put LGBT people at a more disadvantaged position in order to start out. That is part of the problem in terms of the financial disparities within the LGBT community. Next, please. When we start looking at workplace discrimination and then wage and salary statistics, we see that the annual earnings of transgender women decreases by 33% following their physical and social gender transitions. Transgender men don't actually seem to have that same level of financial impact, but it is worthy to note that that does apply to transgender women, that they see almost a 33% decrease in their earnings. 35% of LGBT Americans' ability to be hired was negatively impacted once they came out or that they experienced some sort of discrimination. And 31% of people have faced negative impacts in their ability to be promoted, to get other types of jobs, or had their salary impacted, again, simply because of identifying as part of the LGBT community. Next. First point on this slide indicates that despite it being illegal to fire individuals under Title VII, and we just had that little side note about the Equality Act, even if you go under court cases and court law and state law that indicates that it's illegal to fire somebody based on the protected class of race, gender, sex, religion, again, that doesn't apply. We don't have that necessarily in federal law yet, and many states have right to work. So an employer just basically has to have a reason, or maybe not even a reason, to just say, we're letting you go, you're terminated, and then try to prove that it was based on sexual orientation discrimination or gender discrimination. It makes it difficult at times. 53% of transgender individuals report discrimination moderately or severely impacting their ability to be hired. 51% of Black LGBT individuals report discrimination moderately or significantly impacted them, compared to only 33% of white LGBT individuals. So even within the LGBT community, you're seeing disparities within the subgroup, and they always do indicate, if you've ever listened to sociology classes or psychology classes, that idea that even within a group, there are subgroups that struggle or have their own unique identities or their own particular issues. This just, again, highlights that even within the LGBT community, people of color are impacted sometimes more severely than their white counterparts within that community. Next. Indigenous transgender women facing workplace discrimination. 36% of Indigenous transgender women have reported losing a job because they are transgender. That's significant. 1/3 of individuals basically being let go from work because they identify as transgender. Next. I want to talk about housing for a little bit. And again, you can see there's a lot of information in these slides. If we ran through this, it would probably be here for an hour and a half. So I'm trying to be mindful and cut through as much as possible to kind of give you that highlight of why, what these numbers mean. With regards to housing discrimination, cisgender queer couples are 73% times more likely than cisgender heterosexual couples to face mortgage discrimination. And I want to talk about the third bullet point on there, which talks about something that I learned when I was putting together this presentation this year. I actually discovered that what is happening in some states is that banks actually charge LGBT couples, when they come in applying for a mortgage, they charge more for an interest rate than a heterosexual couple walking into the bank. And one of the subparts of Title VII of the Civil Rights Act is actually that credit. You don't think about it, but credit is one of the protected areas that Title VII applies to. So you can't charge an African-American individual more than a white individual if they're applying for a mortgage, but it's illegal to charge a gay couple more than a heterosexual couple. And so I did the math, I broke it down. It's not a lot, but it can be substantial over time if you think about it. On a $250,000 loan for a 30-year fixed mortgage, 700 to 719 credit score. So let's say identical gay couple, straight couple. The straight couple, if they had a mortgage rate of 3.514, that's a great rate. If you had 3.514, that's $1,125 a month over 30 years. That is a $405,000 loan that you have paid off. Just adding that additional 0.2%, if it is a gay couple, paying that same loan off at 3.714%, it bumps it up to $1,153, making it a $415,080 loan. So that is $10,000 more, and that's only at 3%. I know that there are loans that go at higher percentage points. They could be longer loans, but you already start seeing that cumulative effect of just being LGBT cost you more based on discrimination. Next slide. LGBTQ youth are 120% more likely to experience houselessness than their cisgender heterosexual youth. I want to kind of point out, it's kind of a newer term, houselessness, as opposed to homelessness. Homelessness and the term home tends to imply that there is a connection, that when somebody says that this is my home, this is my hometown, they have connections to individuals, to families, to resources. Whereas when you say that somebody's homeless, it has that implication that they are also then cut off from people, from resources, from the town in which they are living. Houselessness really refers to the idea that somebody does not have a house, but may still actually have family members. They may have friends that they are living on their couch with. They may be sleeping in a closet somewhere, or like whatever the scenario is, but they may identify that as their home because they still have friends and family, but they are technically houseless. So I just wanted to make that distinction. That's kind of a newer term that is being thrown around there. So again, LGBTQ youth are 120 more times likely to experience houselessness than heterosexual youth. And it's estimated that there are about 7 to 8% LGBTQ youth in this country, while 40%, you would think then, I'm gonna rephrase how it says it here, you would think then if you take all the homeless youth that are out there, that should be reflective. So you would think that of, all right, all the youth, if you looked at all the houseless people, 7% would be houseless. We're finding that there are 40% of houseless youth are experiencing homelessness as opposed to their heterosexual counterparts. So not only is it more difficult to afford a home, to find employment, but now we're seeing even higher homelessness rates within the LGBT community. Next. Only 23 states have state or local level laws that protect individuals or households on the basis of sexual orientation. And of those states, 21 have laws protecting individual households on the basis of gender identity. So again, just be aware that depending on what state you live in, you may be in a state that's fortunate enough to protect you if you are having landlord disputes, if you're having issues with housing. There's only 23 states that actually protect you and enforce some type of anti-discrimination based on LGBT status. Next. Medical costs. Again, I hate to say it, it goes back to the pocketbook when we look at cost and how much it impacts being LGBTQ youth or being LGBTQ. We see that 19% of transgender Americans don't have health insurance. almost 20% of transgender individuals just cannot afford or do not have some type of health insurance. And as anybody here may know, whether here physically or on the Zoom call today, if you've ever been in a scenario where you have had to go without health insurance for a period of time, if you have a medical condition, if you had anything that required healthcare, you know just how expensive healthcare is. So it almost puts 20% of transgender people out of reach of being able to go to a doctor and receive any type of care at that point. Around 3 in 10 LGBT Americans face difficulties last year accessing care because of rising costs and healthcare costs. And many LGBTQ individuals, that idea that we talked about, that gender affirming or LGBT affirming type of healthcare, there's a lot of individuals that report that they struggle finding LGBT healthcare that is affirming and that accepts them and understands the unique needs of the LGBTQ community. Next. I alluded to it, without having healthcare, without being able to access medical care, we see what that can cause in terms of stress, anxiety, depression. So you're compounding potentially physical health issues along with now mental health issues. And then just trying to find anybody that will be able to see you and treat you. It's just issue on top of issue on top of issue. There are federal protections around healthcare discrimination. And there, like we talked about before, it kind of depends on who's in office. So even though President Obama enacted protections for LGBTQ individuals in the realm of healthcare, President Trump rolled back those protections. President Biden has not put forth anything yet. It's hopeful that he will via executive order, but it's one of those things that most cisgender heterosexual individuals may not think about, that the whims of a president or a political system dictate via executive order whether or not you have access to healthcare. So just kind of something to think about there. On one national survey that was done in 2017, 68.5% of LGBT people who experienced discrimination said it negatively impacted their psychological well-being, and 43.7% said it physically affected or it impacted their physical health as well, experiencing that type of discrimination. Next. Trans people with incomes over $50,000 were significantly more likely, at 76%, to receive mental health treatment than those with incomes less than $10,000. And we already talked about the income disparity. 48% would actually be able to seek some type of healthcare. And that's usually because there are programs that are built into the system, Medicare, Medicaid, that they can potentially utilize. But again, if there's some things that they may not have access to providers, even though somebody has Medicare, Medicaid, they may not be necessarily a provider who specializes in trans health, LGBT counseling. So again, those are just more issues compounding the problem. Next. Next again, where the last line is cost of PrEP. Just want to touch on PrEP, that when we talk about healthcare and the rising costs of healthcare, when we talk about LGBTQ issues, we sometimes do go into the realm of HIV prevention, HIV infections, or AIDS. I don't want to necessarily focus on that for today's presentation, but I do just want to say that as a preventative, there is out there now PrEP, which can be taken by both LGBTQ individuals and straight individuals as a way of preventing HIV transmission, but without insurance. And again, this comes back to the cost. If you want to ensure that you do not catch HIV, the cost of PrEP can be in upwards of $2,000 a month. And if you don't have health insurance, you'd be paying for that out of pocket. So just something to kind of think about. LGBT youth, the next slide, thank you. So really quickly, just on youth, about 2/3 of LGBTQ youth are out to their classmates, while 61% are out in their school as just generally known by all teachers and everything that they are that they identify that way. About 56% are out to their immediate family, so that they are at least talking and letting people know that this is how they identify. However, that being out doesn't come necessarily without a cost. 17% of youth say that they have been harassed at school frequently once they have come out. 12% say who are not out, but also have experienced on a frequent level some type of discrimination. And 10% who are out at school say they are harassed even outside of the classroom. So they experience it even once they go home via online bullying, neighborhood bullying. They experience that on a frequent level versus 6% who are not out, but they still experience some type of bullying or harassment. Next. 57% of youth who are out to their immediate families have been verbally harassed or called anti-gay slurs frequently, often, or sometimes. 49% are not out to their families, have had the same. 60% of youth who are out at school have experienced some type of harassment, whereas 46% who are not out at school have experienced basically that same level of harassment. 19% of LGBTQ youth indicate that they are scared of the reaction and don't know what would happen if they came out to their family. And 30% already identify their family as not being accepting and potentially homo, bi, or transphobic, so they won't come out at all or say anything. Next slide, please. About 8% of high school students report being LGB and in America, and that is roughly equivalent to 1.3 million children in total. Meanwhile, only 3% of American high schoolers identify as transgender, so that should give you a number of how many people we're talking about here. 42% of LGBTQ youth describe their community as being unaccepting, and in the same study that was done by the HRC, the Human Rights Campaign, 92% of LGBTQ youth have heard negative messages about being LGBTQ youth. So even if you just think about the negative imaging, turning on the news, watching a news program, reading the newspaper about something being anti-LGBT, 92% of kids hear some type of message that it is not okay to be LGBT. And I'm actually, like, the survey of the CDC also discovered that LGBT students were 140 times more likely to skip schools based on concerns of violence towards them than their heterosexual peers. LGBTQ members of the community are 3 times more likely to suffer from mental health conditions as a youth. And LGBT youth also have seriously considered suicide 3 times more than their heterosexual peers, and 40% of transgender people have attempted suicide at least once.
I'm sorry, when was that study published?
The CDC one, roughly around the same time, so like 2018, I believe, 2019. When I was doing my master's work, I think it was as high, or no, I'm sorry, it was 1 in 5. So I think the rates have gone up, actually. I don't know specifically if it looked at eating disorders. I know it just looked at mental health. I have to actually go back and probably take a look at what they specifically looked at for mental health. So, but when we talk about the messaging and what kids are hearing and what we're hearing, I just want to say, like, again, we see all these positive things, but as recently as Friday, March 26th, I say this ironically, sarcastically, can't convey the tone enough, but Arkansas basically proved my point as to why I'm here today. The Arkansas governor signed a bill into law allowing medical workers to refuse treatment to LGBT patients if they have some sort of religious concern. So that was just Friday. Thank you, yes, boo to them. So it's going on, it happens, and that's what I mean. It is not an ending battle. It is why I believe I hopefully have made the case why we still need pride events, why we need to celebrate the LGBT community when we talk about the advances in LGBT rights, awareness, whether it is the passage of legislation. It is incredibly important to work towards some type of federal laws, state laws. I tend to push more towards recognition by federal laws. I think states are great in terms of providing some protections. Not all states. We have a system that has 50 independent states. They can do as they want. Some states, when you think about how the law and the legal system works, states can offer additional protections, but the federal government offers the bare minimum of protections. And if the federal government doesn't have anything protecting legally as a piece of legislation LGBT rights, that's just the bare minimum. States don't have to do anything. Some states choose to, but they don't have to. So that being the case, next slide, how can you help? And the next slide after that, you can become an LGBTQ ally, or you can be an advocate. I kind of give the definitions of what the two are, but basically, when you see discrimination, say something, help that individual, step up, be somebody who in the community is willing to be an ally, be a help for LGBT people, be an advocate, call your congressperson, call your senators, call when there is elections going on, advocating for legislation and for different protections for the LGBT community. Next. And with that, I know this was probably longer than 25 minutes. I apologize, but I hope this was informative and that this gave everyone here some idea as to, again, the reason why the LGBT community still feels the need and the importance for celebrating Pride on a yearly basis. And we hope that everyone here and listening to this presentation also agrees, fingers crossed, that LGBT Pride is important.